Namaste. Today I want to talk to you on periodic health checkups. There are many doctors who tell their clients that once you are 40 years of age, now you have earned so many diseases, like BP, diabetes. So you have to be on the lookout, you have to get periodic checkups and then treat these diseases accordingly. And there are many companies that insist that all their employees get annual checkup done to find the disease at its earliest stage. So before you talk on that, please bear with me. Little bit of medical jargon you have to get accustomed to. So listen slowly. I want to talk about a Cochrane review. It's a systematic review of research in healthcare and health policy that is published in the Cochrane database of systematic reviews. I know it personally because about a decade back I was involved in one systematic review where we reviewed, I along with three British dentists, we reviewed on one type of treatment in dentistry and we arrived at a conclusion. So Cochrane review attempts to identify, appraise and synthesize all the empirical evidence that meets pre-specified eligibility criteria to answer a specific research question. And we also have PubMed, all the medical findings and research results. PubMed is an unfiltered source of primary literature. So whatever is published in the medical field, you will get to read there, comprising of all different types of publication types occurring in academic journals. As compared to that, the Cochrane library is a pre-filtered source that offers access to either synthesized publication types or critically appraised and carefully selected references. So in the research that review that I was involved, for months together, all four of us were reviewing the scientific data, coming at the conclusion and comparing our results, and then finally we made one paper. So the systematic reviews carried out by Cochrane collaboration are recognized worldwide as the highest standard in evidence-based healthcare. So recently on 30th January 2019, Cochrane Review published an article that attempted to find if general health checkups reduce illness and deaths. I will put the reference in the description of this video so you can go and find that paper and read for yourself. But the key messages that they came up with was systematic offers of health checkups are unlikely to be beneficial and may lead to unnecessary tests and treatments. Let it sink in properly. Okay. General health checkups involve multiple tests in a person who does not feel ill. The purpose is to find disease early, prevent disease from developing, or provide reassurance. Health checks are a common element of healthcare in some countries. Experience from screening programs for individual diseases have shown that the benefits may be smaller than expected and the harms greater. Health checks have little or no effect on the risk of death from any cause. So this has been given the high certainty evidence, depending upon the evidence collected from so many published articles. And on the risk of death from cancer, again, it has high certainty evidence and probably have little or no effect on the risk of death from cardiovascular causes, which has moderate certainty evidence. And likewise, health checks have little or no effect on heart disease, which is high certainty evidence, and probably have little or no effect on stroke with a moderate certainty evidence. So having come to this information, we have to understand our health is in our kitchen, in our home, in our body. not in the doctor's office or the labs. Of course, we have to exclude the emergency situations. Okay, then you have to go to doctor. You had a fall, there is a fracture, there is a stroke. Yes, then you need to go to doctor. They may have to conduct some tests. But other than that, all these diseases are lifestyle diseases. You feed your kids all the packaged foods, they're addictive and create so many problems, and then you take the child to the doctor and keep on medicating the child. It is not a good way. And our body, we should be knowing, see, before any disease, the body gives out warnings. So if you are not in touch with your body, you do not come to know of all these telltale signs. The body is trying to tell you there is something wrong, take care. How do you have to take care? By modifying your food habits and increasing your exercise. Move your body. You are sitting all the day in the AC office and eating all junk food, and then what do you expect? So, okay, then coming to the lifestyle diseases, the blood pressure and diabetes. All those people who are taking diabetic allopathy medication, there is a question. Have you come across any diabetic patient who was cured by allopathic drugs? Okay? No, they have to take medication through life, and the medication dosage keeps on increasing. And if the medication was effective, you have been taking all those years, how does it lead to diseases other than that? Like, heart problems and eye problems in the leg. Many severe diabetic patients have to go for amputation of the leg. So how did that drug give you any effect? Did it protect you from anything? It was just suppressing the symptoms. And another very important aspect. So what is diabetic? It is increasing the sugar level in your blood. So you take the tablet, it brings down the sugar level. So in the blood, the sugar level has come down. But that sugar is in your body. Where has it gone? Have you ever thought of that? So it is this sugar that goes to your eyes and other areas, which makes that area more prone to infection, because when there is sugar, that area is more prone to infection, and you get the complications. So think twice before going for an annual medical checkup. When you think, I am getting so many warning signs from my body, I need to find out, maybe I am at a loss to understand what is wrong, then go to a doctor, get checkups. And the test being done is another area altogether. Okay, if there are so many labs which use almost nearing expiry date chemicals, and then there are test results given wrongly also. During the peak of HIV season, that many high-paying clients, their report was given wrongly as HIV, so that the labs and the doctor could earn from those clients. So many times it is not giving the actual test result. So we have to consider all those factors. So if the test can be depended upon, why then the doctors advise tests from different labs? You took one report, he told no, this has to be repeated, there is some doubt, repeat it in some other lab. Why is that happening? So this is my final advice. Your health is in your hands. Take that seriously. Give the body the food that it needs. Not what your taste buds are telling you. You take care of the body and the body take care of you. So let that be the dictum. And I always say that either you choose pain or pain chooses you. Okay? You are going to a hotel and seeing all the spread of all the things made of refined flour and sugar and all those things. And then if you have to stick to salad and healthy food, you are giving pain to yourself. Okay? But you eat all those things. Now when you give pain to yourself, you have some control on that. And when you don't listen to the body and eat all those crappy things and don't sleep properly, don't give rest to the body, don't do exercise, and then time comes, the pain chooses you. You don't have any control on that situation. So which would you like to have? Think on that and take decisions in your life, whether you want to go for annual health checkups every year or you want to lead a healthy lifestyle. It's up to you. Okay, bye, namaste.